Hi, my name is Kevin Reyes, and I am a medical student at the University of California, San Francisco. This presentation will be on a targeted interest survey of preclinical medical students for implementation of exposure opportunities in multidisciplinary oncology education. With the growing prevalence of cancer, fostering multidisciplinary interest in oncology is an important priority in medical education. However, medical student interest in radiation oncology has declined in recent years, in part due to a lack of exposure. A study by Wu et al. In 2021 that issued a survey to radiation oncology programs that are associated with medical schools found that the majority of medical students did not obtain any exposure to radiation oncology, and an even greater percentage never considered the specialty as a career option. Thus far, there have been efforts made to increase formal radiation oncology lectures within didactics, and preclinical extracurricular activities can provide unique opportunities for meaningful exposure to oncology, including radiation oncology. This study aims to assess current interest for oncology-related activities in preclinical medical students to facilitate meaningful exposure to oncology and innovative integration of radiation oncology-related curricula. An anonymous web-based survey was created and distributed to the first-year class at a single academic institution. The survey included questions exploring interest in oncology-related talks, mentorship, shadowing at Tumor Board discussions, and participation in a longitudinal cancer patient advocacy program. The survey was distributed to 169 students with a response rate of 33.7%. Among responders, the highest interest activities were lectures at 100%, tumor boards at 89.5%, mentorship at 61.4%, and volunteering at 57.9%. For oncology-related elective talks, students were most interested in surgical oncology and medical oncology, followed by radiation oncology and others such as surgical, neuro-oncology, immuno-oncology, and gynecologic oncology. Regarding the topic-based talks, 68.4% of students were interested in discussions about how to break bad news, 66.7% in addressing the high costs of cancer care, and 63.2% in cancer disparities. There was also interest in other topic-based talks such as interweaving end-of-life care, cancer patient panel, and a multidisciplinary oncology careers panel. As for tumor board shadowing, respondents reported an appreciable interest, with lung cancer receiving the most interest, followed by breast and head and neck. There was also some interest in attending tumor boards for other disease sites such as CNS, genitourinary, gynecologic, and gastrointestinal cancers. There was also a question in the survey regarding interest in volunteering in a longitudinal cancer patient advocacy program. Among the respondents, 61% of them were interested in participating in the volunteer program, and an additional 9% of students were possibly interested in becoming involved. When asked about potential interest in receiving mentorship from oncology-specific residents/fellows, the majority, 66% of students, demonstrated interest. In particular, 23% were interested in being mentored by someone in medical oncology, 13% for surgical oncology, and 26% for any oncology specialty. However, it should be highlighted that there was only 4% of students who were interested in receiving mentorship specifically from a radiation oncology resident. A significant proportion of surveyed first-year medical students at a single institution are interested in oncology-related talks, tumor boards, mentorship, and volunteering. However, there was disproportionately lower student interest in radiation oncology-specific topics and mentorship. This data supports invested development of robust, sustainable extracurricular oncology programs during preclinical years. These results also help guide areas to focus our efforts to cultivate and solidify interest in oncology with unique opportunities to integrate radiation oncology curricula. Thank you for listening to our presentation.